All right. Welcome, everyone, and thank you for joining. My name is Angelica Cardenas, and I'm a health educator for community health at Atlantic Health System. Today's webinar, Recognizing the Gender Gap in Heart Attack Symptoms, Men versus Women, is presented by Dawn Seek, Assistant Nurse Manager, and Christine Dorenbush, Senior Exercise Physiologist, both from Cardiac Rehabilitation at Chilton Medical Center. Before we begin, I have a few announcements. Please know that this webinar is being recorded. All participants are muted. If you have questions, please use the question and answer button for questions or the chat for comments. We will try to get through all of your questions at the end of the presentation. Right, and understanding your risk for heart disease is essential for maintaining your health and well-being. By answering a few questions in our two-minute quiz, you'll be able to take proactive steps to protect your heart health. So if you'd like the link to that, you can take a moment to scan the QR code on your screen.
Hi, welcome. My name is Dawn Seek, and I'm the Assistant Nurse Manager here, and I'm joined with Christine Dorenbush, our Senior Clinical Exercise Physiology. We will be going over recognizing the gender gap in heart attack symptoms. Just trying to get... Oh, yeah. Sorry. Okay. So our objectives today are to list the differences between men and women, the differences women and men may experience while having a heart attack, identify the benefit of cardiac rehabilitation, and identify at-home exercises for optimizing heart health. So there are non-modifiable risk factors and there are modifiable risk factors. These are risk factors that you can't modify that you are born with. So age is one. So the older you are, the higher at risk. Gender, males are more at risk than women. Family history, strong family history usually will affect you. And race will also be non-modifiable. So these are modifiable risk factors that you can work with. So you can work on your cholesterol with your doctor, either by exercise or diet. Blood pressure, keeping your blood pressure in control. Diabetes, keeping your blood sugar within control and your hemoglobin A1C. Tobacco use, to refrain and stop smoking will also help. Alcohol consumption, excess body weight, physical activity, and healthy eating. This is a BMI chart, and on here, what happens is this will give you risk factors. If your BMI is under 25, you have a minimal risk for heart disease. Moderate risk would be overweight, is a BMI from 25 to 29, and high risk or obese is considered a BMI of 30 or above. So if you look over at 5'2", a minimal risk would be 135 pounds or less. A moderate risk, you would be 132 to 157, and that would be considered overweight. And then high risk or obese for 5'2" would be 164. What is cholesterol? Cholesterol is a waxy fat-like substance you make in your liver. Blood cholesterol is essential for good health. Your body needs it to perform important jobs such as making hormones and digesting fatty foods. Your body makes all the blood cholesterol it needs, which is why experts recommend that people eat as little dietary cholesterol as possible on a healthy eating plan. Dietary cholesterol can be found in animal foods, including meat, seafood, poultry, eggs, and dairy products. And cholesterol is the number that the doctors will be working with, and that is included in your lipid profile. And we usually check the levels of cholesterol and triglycerides in your body on your routine exam. Low density lipids, which is the bad cholesterol, or you can say lousy, so L and L, lousy cholesterol. Having high levels of LDL can lead to plaque buildup in your arteries and result in heart disease or stroke. High density lipoprotein, or the good cholesterol, is higher levels of it can lower your risk of heart disease and stroke. So the higher, the better. So not smoking and exercising can also help increase that. Triglycerides, a type of fat in your blood that your body uses for energy. The combination of high levels of triglycerides with low levels of HDL and high levels of LDL may increase your risk for heart attack and stroke. And the triglycerides can be anything that breaks down to sugar. So breads and anything like pasta will increase your triglyceride levels. Total cholesterol is the amount of cholesterol in your blood based on your HDL, LDL, and triglyceride numbers. So what we aim for is a total cholesterol of under 150. The bad cholesterol, we want to keep under 100. Now, if you have heart disease, your cardiologist may try to keep you under 60, 70, or whatever number they have deemed fit to have you lower with medications. Good cholesterol, if you're a male, you want it greater than 40. The higher, the better. So, and for women, we want to be above 50. So exercise and not smoking will help increase that. Triglycerides, like anything with the breads and pastas, you want to keep that under 150. So if you're eating breads and pastas, cutting that back will help you lower that. What is high blood pressure? High blood pressure, also known as hypertension, is blood pressure that is higher than normal. Your blood pressure changes throughout the day based on your activities. Having blood pressure measured consistently above norm may result in a diagnosis of high blood pressure, or the physician may call it hypertension. The higher the blood pressure levels, the more you are at risk for having other health problems such as heart disease, heart attack, and stroke. So your doctor can diagnose high blood pressure and make treatment choices by reviewing your systolic and diastolic blood pressure and comparing them to levels in your in the guidelines. So that's the upper number and the lower number. This is American Heart Association blood pressure guides. The normal 120/80. Elevated would be your top number. The systolic is anywhere between 120 and 129, and diastolic less than 80. High blood pressure or hypertension stage 1 would be 130 to 139 or 80 to 89 on the diastolic. And high blood pressure hypertension stage 2 is greater than 140 on the upper number and greater than 90 on the lower number. Hypertensive crisis, where you consult your doctor immediately or go to the ER, is the blood pressure is greater than 180 on the top number and greater than 120 on the lower number. Symptoms in women. So women can have chest pain, but not always. You can have pain and pressure in the lower chest or abdomen. You can have jaw, neck, or upper back pain. You see that a lot with women that have this pain and they think it's a toothache or something. Nausea or vomiting, shortness of breath, fainting, indigestion, and extreme fatigue. These are all symptoms that women can have. So even if you're thinking you're having some pain in your abdomen and you're having indigestion, if you have other symptoms, these could also be heart attack. I should say symptoms of heart disease. So you need to discuss this with your physician. Symptom is men, they can have squeezing in the chest or a pain. They can have arm pain also, jaw and neck pain or back pain, nausea or vomiting, and shortness of breath. And what can you do if you're having a heart attack? So if you experience any of these symptoms, you get sweaty, you get flush, you are having chest pain, jaw pain, indigestion pain, you want to dial 911 immediately. And then the 911 operator will give you instructions and they will send you help immediately. So getting to the hospital, the quicker you get there, the better. So time is muscle. So the quicker you get there, the more muscle you save in your heart. So you want to get there immediately. But do not drive yourself. You don't want to have an event going there. You don't want to have your family member driving and you pass out. If you're in an ambulance, they can help you. So always dial 911. While you're waiting for them, take some nice, slow, deep breaths. Wait for the emergency responders. They will be coming to you. Women who think they're healthy often misread the symptoms of a heart attack because they don't think it could happen to them. That's why it's crucial to learn about heart attack, knowing your numbers, and living a heart healthy lifestyle. Here at AHS, we have the wonderful thing of smoking cessation program. This can help you breathe better, improve your health. You can save money. You can have more energy and control of your life. What happens is you would be calling each facility has their own smoking cessation program. You would call them and they would give you support. They actually have smoking cessation treatments. They have nicotine replacement and it's no cost to you. So we recommend you calling them and then joining their program. It's usually 6 weekly group meetings and you learn techniques to stay away from smoking and quitting smoking. So the space is limited. So we have you call and our numbers are right here. Chilton, we have a class on Thursday. That is their phone number, and Kathy is wonderful to help with all of your smoking cessation needs. Newton, Morristown has 2 facilities, Hackettstown and Overlook. These are the phone numbers that you would call, and then they would be getting back to you to give you advice and then to schedule you to come in for the class. Now I'm going to turn it over to Christine Dornbush, who's going to talk about cardiac rehab.
Hi, everyone. I'm Christine. I'm the exercise physiologist here at Cardiac Rehab. Tell you a little bit about our cardiac rehab program. It's specifically designed for heart patients and combining exercise and lifestyle educations and a personalized support to enhance your fitness levels, overall wellness, and reducing your chances of future heart attack problems. What can cardiac rehab do for me? Reduce your risk factors for heart disease. We can improve the efficiency of your cardiovascular system, so building endurance and strength. Enable you to safely increase your activity level while being supervised. Increase your endurance, improve your overall capacity for work and recreational activities, help control your weight and blood pressure, and improve an overall outlook on life and feel better. Who's eligible for our cardiac rehab program? Insurance usually covers a 12-week, 36-session program. That does vary depending on insurance, but the covering diagnosis would be valve surgery or repair, including TAVR, open heart surgery, coronary artery bypass grafts, stents and angioplasty, heart attacks, stable angina, when a stress test is within 1 year required. And stable angina is usually chest pain. Congestive heart failure within the verification of ejection fraction, which is how your heart pumps. So there's certain levels that the Medicare requires. Heart and lung transplants. The phases of cardiac rehab. So when you're in the hospital, that would be phase 1 cardiac rehab. It's the inpatient setting, usually post-surgery, post-angioplasty. A nurse or a cardiac rehab staff member will come to you. When you have surgery, they usually walk and do some range of motion exercises and chair exercises. It also requires an order from the cardiologist, which most give you. The phase 2 program is once you're home and recovered, it's the monitored outpatient setting. It's usually anywhere between 2 and 6 weeks after the cardiac procedure. If you have an angioplasty, you'll be in there quite quicker. If it's a bypass surgery, usually wait about 6 weeks until you're eligible to drive again and you're more independent. Phase 2 takes place about 3 times a week for approximately an hour, and it depends on what we have you doing. Medicare covers you for 12 weeks, 36 sessions, and it consists of cardiovascular exercises. Here at Chilton, we have treadmills, bikes, a stepper called a new step, arm ergometers, which uses the upper body, and an elliptical machine. We do have basic hand weights that we introduce, and you do a variety of different exercises. Insurance usually covers the phase 2 cardiac rehab, and EKG, heart rates, and blood pressures are recorded while you're here. This also requires a prescription from the cardiologist. The phase 3 rehab is an unmonitored outpatient program. When the patients finish the phase 2 program, they are eligible to continue on an out-of-pocket expense. They use the phase 3 program like they would be coming to a gym. They continue in a rehab setting, and they continue to have their blood pressures monitored while an updated exercise program as well. It's a great opportunity for those who don't feel comfortable going out to a public gym or fitness center, and they enjoy the socialization with others. This requires an annual prescription from a cardiologist. At Atlantic Health, we have a variety of different hospitals that offer the cardiac rehab program. Here are all the hospitals: Chilton, Morristown, Newton, Overlook, and Hackettstown, and their phone numbers. You can easily call to inquire about our programs, and we can give you all the details how to get started. Always check with your physician before starting any exercise program. Safe exercising. Patients with heart conditions should not exercise outside if it's too cold or too humid. If it's under 40 degrees and you're outside walking, you should always cover your face, not to inhale all those cold air. When it's hot and humid outside, that's also dangerous, so you want to make sure that you either exercise early in the morning or later in the day on hot days. Please always stay hydrated. Drinking water is the most important thing. When you're exercising, you always want to do a 3 to 5 minute warm up or cool down after the before and after exercise. Just like if you were going to start a car, you would start your engine and let it warm up a little before you accelerate it. At the end, you park your car and you let it cool down and walk away. Same thing with exercise. You always want to carry a cell phone if you're walking outside, or tell somebody where you'll be. If not, walk in groups. Carry identification with you while you're outside walking. Always have a list of medications, whether you keep them in your phone or keep a printed list in your wallet. If you're walking outside, please make sure the surface is even and clean. Watch out for loose gravel, potholes, uprooted sidewalks, and now watch out for the salt that they've been spreading all over the place. Please dress appropriate so vehicles and others can see you, including electric scooters, bikes, all those good things. Make sure you wear bright colored clothing and reflectors if walking around at night. And please be able to hear surrounding sounds. A lot of people use earbuds, so you really want to know your environment. So please make sure that you're able to hear the cars and the people around you. What can I do to increase my steps in daily activities? A lot of suggestions are, there's many ways you can increase. I like to park furthest away from the stores. So if you go in a faraway parking spot and you walk to the door, that's always going to give you more steps to your day. Another way to increase your steps and activities are just taking the cart, and when you're done and you load your car, you put the cart back. You don't leave it next to your car. These are extra ways just to add steps that at the end, when you add it all up, it makes a big difference. You can take the stairs rather than the elevator, up and down. If it's cold outside or in the wintertime, you can take a group of friends and maybe go walk in the mall or use the supermarket, Costco, BJ's for fitness. That way, it's a flat surface, it's safe, and you can walk around in a good climate activity. While you're sitting and watching TV, you can do some chair exercises. You can do toe rises, arm circles, leg lifts, anything to keep your legs and arms moving. Take a walk at lunch while you're working. That's an easy way. We like to do that here. Take a good walk around the building. And you can add extra time and mileage to your day with walking by having a pet. A lot of people walk their dogs. Start a walking group with a bunch of friends or neighbors. The company makes exercise certainly more fun. Attached here are some simple exercises you can do at home, and you can use simple ways to do things. Couches or chairs are perfect. Countertops to lean on and do leg lifts. We have leg squats here that are examples, some leg curls, some leg extensions. You can use some side kicks on the side leg rise. Bicep curls, overhead press, and the weights listed. You don't have to go out and buy fancy equipment. You don't even need to go out and buy weights. You can use simple things like soup cans, water bottles. If you want to add a little bit more density, you can throw the water bottles in the freezer, anything like that. Simple little things in the house can be a good tool for exercising, and you don't have to go out and spend a lot of money. Here are sources that we used to make this presentation, and we hope you enjoyed it. If you have any questions, please be certain to reach out. But just remember, exercise can be fun. People are intimidated by it at first, but in the long run, it becomes a part of your life and it makes you healthier and it decreases all those risk factors. And all you need is anywhere from 30 to 45 minutes a day. Hope you enjoyed the presentation.
All right, and that is all the time we have for questions today. Thank you to Dawn and Christine for your presentation. I will send out an email to anyone who attended the training, the webinar today, with the exercise PDF that you all shared. And lastly, when I close out the webinar, there will be a survey for you to fill out. So please take a moment to provide your feedback on that survey. And that is all. Thank you again, Dawn and Christine, for your time. And thank you everyone for joining today's webinar.
Thank you very much.
Thank you very much. Stay heart healthy.